Good morning, my name's Wendy McCracken and I'm the Clinical Educator for Elevate Health. And we're here today in Prague at SESAM 2024. And I'd like to introduce Willem van Meurs, who is the co-author of Learning Physiology in Context. And if I may, I'd just like to offer you some questions so we can find a little bit more about your book and what you're doing with your project. So the first question I'd like to ask you is, what would you say are the benefits of simulation in healthcare education?
Yeah, morning, Wendy. Yes, I think the single biggest impact over the last couple of decades is that we totally replaced animals, large mammals for training, for example, of medical students. And when I think about training, for example, residents in anesthesia, we replaced real patients by simulators. So that's a definite impact. A second major impact is that we now have control over educational content. We can simulate 8 incidents in an afternoon rather than having to wait for them for a whole year.
Explain to me a little bit more about the title of your book and exactly why you use the word context in that title.
So it's a very short title, but it has a double meaning. The in context refers to the aspect that we teach physiology in a clinical context, which is very engaging for students, because they're not just reading a physiology book, but interacting with a simulated patient. The other reason we use the in context is that each and every physiological system is embedded in something else. A heart is embedded in the circulation is embedded into the cardiorespiratory system, so we teach physiology in that whole body context.
And what have been the outcomes? We know that there's been a lot of work done at Bristol University, who are an early adopters of physiological model in healthcare education. What would you say the benefits and outcome of that have been?
I think the major impact was that is in terms of throughput. They managed to teach. Initially, they were teaching physiology in a traditional simulation mode with 10 students standing around the simulator, 1 instructor, 1 technician. And in a number of progressive implementations and using what we call virtual patients, they managed to go all the way up to 250 students simultaneously in a theater, still with 1 instructor and 1 technician. And in that whole process, the learner satisfaction stayed the same and the learning outcome stayed the same. And that would not have been possible without using model-driven simulations.
Can you share with us how the integration of the physiological model within healthcare simulation, what are the benefits of that in the context of learning?
So as part of the process, the mannequins, of course, have a fixed anatomy and a fixed ethnicity, for example. And by using the virtual patients, we can now easily simulate an elderly patient, an Asian person, a pregnant patient. So going from either medical students or mannequin-based simulators to virtual patients had this huge advantage that we can introduce a number of very diverse patient profiles.
And why do you think it's important for healthcare educators to use these approaches and integrate them?
Well, it's real life. When you become a practitioner, you're going to not just encounter healthy 20-year-olds. And you're going to encounter people from all kinds of sizes and ethnicities and with all kinds of pathologies. So yeah, it's absolutely essential to introduce that diversity early on.
So given your expertise in healthcare simulation, what is the significance of the physiology and the integration of that model within innovative solutions like Maestro Evolve and Lucina, our high-fidelity mannequin?
We're mainly talking, I think, about the model-driven aspect of both Lucina and Maestro Evolve. What these underlying models do for you is that they generate all these clinical signs, blood pressures, heart rates, respiratory rate automatically. So that tremendously helps the instructor and the technician. They don't have to do that on the fly, and they can focus totally on education. Another, a bit more subtle advantage is that if students suggest a very unusual therapeutic intervention, you can still apply it and get a response. And that would be much harder, or it would be impossible with a scripted simulator and it would be much harder for a technician to have to key in all the blood pressures and heart rates and respiratory rates for a very unexpected intervention. So again, diversity.
And finally, Willem, I'd like to ask, can you share your thoughts on how educators use cutting-edge technology with the integration of healthcare simulation in the physiological model?
Yes, the book gives a number of inroads. We have an endpoint that we describe in detail, but we also describe the whole process of going from teaching around a mannequin to teaching in a larger group around the mannequin to teaching via video links, and then later on these virtual patients. So depending on what stage and what conditions people have, they can pick up one of these models and then elaborate on them. And but the end point is teaching with a virtual patient and a monitor emulator to a large room with high numbers of students, and of course the main impact being that then physiology or simulator-based physiology teaching becomes a lot more efficient.